I think the biggest challenge in being the GP is also the one that gives you the most amount of satisfaction, and that is the variety. Not knowing who's coming in, it challenges you personally with some of the problems people have, but also it challenges intellectually, academically, keeping up on top with the latest changes, because it's changing all the time.
The challenge is also one of the positives as well, in that there's such a variety. You don't know what your patient's coming in with. You may not necessarily know what the problem is. You have to use a bit of time. You have to maybe do some more investigations and sort of communicating that to the patient. You know, I don't quite know what this is at the moment, but let's do this. Let's get a few more bits of the jigsaw puzzle.
You quickly notice the difference between when you work in hospitals compared to general practices, that you have a lot less ability to get instant tests and instant access to information, for instance blood results and x-rays, and so it can be quite a challenge, because it's so broad. You can see in a morning 13 different patients with 13 different problems from 13 different systems, and so you have to be fairly kind of good and easy to switch between different medicine, and even in the same patient there's lots of problems going on at the same time, so that can be quite challenging clinically. And I think because you've got the pressure from not only the patient's demand but also the demand of the local CCG and their kind of ability to wanting to kind of guide you in terms of what they want you to prescribe or not, and also the NHS England and the QOF targets set by NICE in terms of what we're kind of constrained to check as well. So there's lots of different pressures, so that can be a challenge, not only clinically but also on a day-to-day basis.
I think the biggest challenge for being a GP is the demand on the service. And as you know, obviously there's always stuff on the news about the NHS with a lot of demands, and being GP being the first point of contact, is the pressures on GP.
The biggest challenge, I think it's a huge learning curve, because as a GP you can't say, oh, that's not my specialty, I don't know what to do with that. Or you can say that, but you still, it's your responsibility, you have to sort it out. So in hospitals, for example, when I did A&E, I'd often see people with something that's not life-threatening but needs sorting, and I wouldn't know what to do with it, and say to them, or write to the GP and say, please can you look into this. Whereas as a GP, it's your responsibility. So you can refer to your specialists at the hospitals, to specialist colleagues at the hospitals, but you can't, you still have to sort it out. So you have to learn a little bit about everything, and you have to be able to find out the information. So it's a big learning curve, but there is plenty of support about, so you don't feel like you're isolated and by yourself.
As being a trainee, you're very supported. I've been very lucky, and I'm in a very nurturing kind of practice that looks after its trainees. So you're supported from your GP trainers to reception to a secretary. There is always somebody around that will know the answer to the question that you've got, and if they don't know, then we put our heads together and come up with an answer.
So we're supported obviously by giving direct feedback to our supervisor as a trainee. So they'll be able to talk to you about how you're managing, how you're kind of getting through on a day-to-day basis. Similarly, if there are any kind of other issues, we can bring them in a practice meeting, which could be then taken forward to either the LMC or the CCG if necessary.
I feel really supported in this placement. We have lots of people that we can ask, be that other GPs, be that other nurse practitioners who maybe work more with the social side of it as well, so they can, if there's, for example, somebody who we want or feel could benefit from a day centre placement or just needs a bit of extra support at home, we can easily just ask that side of the team for a bit more of the support. Again, with palliative care, we can easily ring up the Macmillan nurses and they'll, arrange what they can. So I think we're supported really well.
You can discuss with your colleague that you trust, or you also have your educational clinical supervisor, someone that's actually superior over you, which you can have a chat with as well. So the support is there, but the key thing is not to burn yourself, overburn yourself. It's to be able to know what level of competence and know what level that you are rather than having to burn yourself, because you have to remember that you're providing service to the public, and if you burn yourself, you cannot provide that effective service to the public. So my to answer your question, you could discuss with your colleague the other places that you can go to get counseling to really boost your re-energize yourself again. Also, you've got your family as well there to re-energize you as well, which is very important. Yeah.